Okay, so this is RESP MED, and gonna show myself how
But
this
if they
works.
keep
So I
not
don't.
coming in with it, you are not changing settings. This
Yeah,
is not acute care BiPAP.
yeah.
This is for sleep
This is
apnea.
for sleep apnea only.
Mm-hmm.
So the way you put the settings is you press hold home button, and press the knob, and press both hold it, press it and hold until you see a setting. You see the setting here? It says setting, and you press setting here. Then you see this turning knob. See, it's highlighted here. Highlighted to you have to highlight to setting, and then you press, and then you're gonna see a mode. Put the knob down up. You can see mode here. You can see mode. What mode do you want? And then you press on it. It has if the doctor orders CPAP, you gotta go CPAP. Doctor order BiPAP, you better put S. Okay. And the other one we don't. It's auto, but we don't do that yet. It's not that commonly used. So anyway, I mean people do use it, but I'm not sure if the residents at home they use it much. But I know most of the time it's CPAP, and then they make doctor make also call order a BiPAP, which is S. Okay, so if they do CPAP, just to one pressure. Okay, so just press button, and then I'm sorry, going back, press, and then you see CPAP here. When you CPAP here, you press like that. So now the CPAP mode, right? The mode says CPAP. Now go down, press knob down to where it says how much set pressure, how much pressure you want. The doctor order 5, 6, 6, 7, whatever. So you see that as I my camera the camera is not that good. The lens is not good. So but anyway, it's showing 5 right now. But you can turn your knob as how you want it. You just you do clockwise. If you turn the right clockwise, it goes up, and then the counterclockwise goes down. Okay, so usually 5 is pretty common. So I'm going to go back down to 5, and when you're done 5, press one more knob, one more press, it then highlights it at 5, and then go down here, mask. Okay, usually I think it defaults as full face. I'm pretty sure, but let's press anyway. Let's press it. Oh yeah, see, yeah, it has a pillow. It has a pillows, and then pillow just pretty much means it's sometimes it covers nose and mouth both. But I mean, I'm sorry, pillow just means some covers nose, but it's more like a more bulky size. It's just a little bit bulky. But the full face is the whole mask. The covers most nose and mouth both. But you guys already know this already. But nasal is just a nasal only. The small nasal ones that nasal prong ones that fits right in the nose, nasal. That's what that is. But pillows are just a tad bit bigger than nasal, but it's a lot smaller than face mask. Okay, so for face at home, most likely, I'm guessing is pillows pretty common. I'm guessing, but they do have nasal too. So let's just do pillows for now. Okay. All right, let's do pillow for now. But at hospital, we don't use it as much for this home BiPAP, but maybe nursing home they use it. Okay, so let's just do pillow or nasal, doesn't matter. Let's just leave it at nurse pillow for now. Okay, so it doesn't matter what you have. Okay, then you go to arrow down to the ramp time. The ramp is how fast the flow goes. As soon as patient's on the mask, put this mask or nasal or pillows to the nose, to the face. How fast you want this. Sometimes they're new on it, so the ones who are used to it, they're fine. But the ones there's new patients who are new, not on it, never used it, so you don't want to do ramp to 1. Sorry, let's just press on it. Default to 5 looks like. I don't know, I'm sure what the default to, probably 5. I'm not sure it says 5, but maybe it's not. I don't know, let's see. But anyway, so you can go down, press it, and then, oh yeah, see, 5 is the lowest it goes. After 5 is off. So it's 5 right now, so leave it at 5. 5 is pretty good. So you don't want to go a little higher than 5. So 5 is how fast the flow can go up. You know, how fast the breath can, the air can come, air can push to the face. So usually it's default to the 5. Leave it at 5 is fine. All right, let's go back here. Okay, so where's the exit button? Okay, home. You see, you gotta keep turning it until you see home. Okay, the highlight to home. When you see the home, press again. It goes right back. Okay, now you have settings done. Underneath is sleep report. We don't need that. So go back to highlight to exit clinical menu, press that, and now back to where it was. Okay, that's it. So that's pretty much it. It's very simple, but you can watch this if you ever use this. You can just watch this video and just remind yourself. Let's just go to report and see what it shows. Actually, let's go to my option, see what it shows here. Okay, my option shows whatever you set it. See if it says whatever you set it just now. See what it says. Option RAM time is 5. Mass is pillow. Run mass fit. I don't know. I don't think it's used that quite often, but it says good. Yeah, it says it's fine. You don't have to do nothing there. So whatever mass you put is fine. Okay, so as soon as you put it, maybe it adjusts itself or something. So go to sleep report. So sleep report just tells you how long patient was on CPAP or BiPAP at night, how long patient used it, all night or what. It just shows your time, how long patient used it. Okay, that's about it. And the mask is sealed or not. Right now it's not on, so maybe it's showing red. Okay, so that's about it. I don't know what this my area is. Track your sleep health, and yeah, I don't know what this. Okay, so this is go back home. So that's how it is. This is a home button. Okay, again, if you wanna turn it off, there's a stop button here. There's stop button. Press stop, and then as soon as you press stop, it stops. Oh no, this whole thing is like yeah. Okay, it stops it. See, it stops it. So now, if you want to stop it, I believe you press and hold where it says start button here, or this one doesn't matter. But you just press and hold. Press and hold. Okay, but first you gotta press OK here. Okay, press and hold. Okay, so one is running. Let's just start it. Okay, let's start it. Okay, I'm starting. I press start, but there's no connector right now, so it's not gonna do nothing. It's gonna keep saying it's a leak. But once you start it, once you start the button, then you press. Then patient's on the BiPAP. Patient's on the CPAP. Okay, or BiPAP. And then if you want to stop it in the morning when patients come off of it, you just press, if I'm not wrong, press start button and press hold. There you go, shuts off. Okay, done. As simple as that. Now again, if you turn it back on, you press start again, and then you don't know what the setting is, press hold button, home button and knob, both pressed together, and it's going to show setting. You see that? I'm just going back to what I was doing before, just to review. And then you choose setting here. You press, make sure the highlight is highlighted to setting. Press the knob button to see what you want. Okay. Under mode, you press what mode you want. We're going to press it, and you can press it here, and it tells you BiPAP is SS, CPAP 1 pressure is CPAP, 2 pressure is BiPAP. Okay. So S is BiPAP 2 pressure. CPAP is just regular 1 pressure. Okay, most of the time CPAP is just generally for like sleep apnea or things like that. Most of the time, majority, almost 100% CPAP, just regular CPAP. And then some patients who are COPD or asthma or whatever, most of the time COPD or high CO2 at night, then you most likely doctor will order BiPAP, which is S. It's got 2 pressure. It blows out more CO2, things like that. So that's about it. And then let's go back to cancel, because we already have it there. And then pressure, set pressure, as I told you here. What pressure you press on it, you just go up and down what the doctor ordered. Okay. Now let's go back to CPAP. Let's choose the BiPAP. If doctor order BiPAP, choose one. You just remember you have 2 pressure now. You have IPAP and EPAP. Okay. If you press BiPAP, which is S here, under it says ISS, which is called S is same as spontaneous. Okay, so spontaneous button, you have to choose 2 pressure, which is IPAP 10 right now. If your doctor order 12, you press on it. 10 is pretty common, but if you put 12, you go up like this. Okay, when it goes 12, and you press again, and it goes back. I want to leave it at 10 because 10 is the most common. Go back down to EPAP, is a positive pressure during expiratory breathing, and you press on it and what the doctor ordered. Usually 4 is the minimum, but let's see what it is. So yeah, it goes down to, but 4 is pretty the lowest they order. Okay, but 5 is more common. So leave it at 5, press again. So IPAP 5, EPAP 5, 10, IPAP 10, EPAP 5. Okay, that's it. So the other thing, easy breathe on and time TI inspiratory time max like 2, leave it like that. It doesn't matter. It's a default. So let's go back to home, and that's it. So now you just press on, machine is turned on, and patient on it. All right, that's it. Any questions you can write in the bottom, but I'm not a professor, so don't ask too difficult question. But anyway, just any comment you'd like to suggest or anything you know that we need to, maybe we all need to, whoever's watching this, if you know something that we need to, it may be good for us to learn, just write it down, share the knowledge.